On this episode of the Inside Athletic Training Podcast, we're joined by Dr. Peter Chalmers, orthopedic surgeon and shoulder and elbow specialist at the University of Utah. We discuss his recent presentation on thoracic outlet syndrome return to play from the Baseball Team Medicine Conference, along with broader insights on injury management, recovery, and the evolving collaboration between physicians and athletic trainers. Enjoy the show. All right, Dr. Chalmers, welcome to the Inside Athletic Training Podcast. We're very excited to have you on to discuss all things baseball, sports medicine, your career, working with athletic trainers and all that good stuff. To start for today, I wanted to give you a chance to share with our listeners a bit of background information about yourself. Where'd you grow up? How'd you get into sports medicine? And what kind of ultimately led you to where you are in your career today?
Well, thank you, first off, so much for having me. It's a delight to be here. And I really appreciate the effort that you've made, Sam, as well as all the PBATS members make, on the behalf of our players. I come from kind of a variety of places. I was originally from Oregon, where I was an athlete in high school. And then I went to college, at Dartmouth, where I was also an athlete. And through that, had my own injuries and my own kind of experiences with athletic training, with physical therapy, and saw really the benefit it could have for athletes and get people back on the field. And so sports were really important for me and my development. And then after college, I actually went and taught high school for a year. So I taught at a high school called the Punho School in Honolulu that has a really, really strong athletic program. And I was a coach there as well. So I, through that, again, saw my own athletes, saw them work through injuries. And it wanted to be a doctor, but through that really kind of saw like working with athletes was something I was really interested in. It was a strong part of my background. Mm-hmm. So when I went to medical school, I became very interested in orthopedics as a result, and then was at medical school in Columbia, New York City, and then was a resident at Rush in Chicago. And when I arrived there, one of the people that most really inspired me was Tony Romeo. And I don't know if you've had him on the podcast, but he's a really important person in our field. He's great. And basically what happened there is that he began working with the MLB to say, hey, you guys have a lot of data. You've never done anything with it. We'd love to work with you. And during that time, I'd done a lot of research with him and kind of showed him that I had a good understanding for how to work with data. And then once he got working with MLB, they started sending him data sets. And then he said, and every data set was like 6 different interconnecting Excels that all had different data in them. And then he just sent them to me and said, can you figure out how to analyze this?
Yeah.
And that's kind of where it started. From there, we've done a lot of work using the HITS database, and I've been so fortunate to have the commissioner's office as collaborators. I think they're very interested in doing whatever we can to figure out how to improve player health. Mm-hmm. And then in my own clinical practice, I take care of a minor league team here in town, as well as a lot of local collegiate and high school kids, and the occasional pro. And through that, I've really enjoyed taking care of baseball players. It's, as you know, a really unique population of people who really wants to get better, and it's just awesome to take care of athletes. So that's been a huge privilege for me in my career, and that's kind of how I came to it.
Awesome. Yeah, and obviously you're in Utah working at the clinic, like you mentioned, also, I believe, with the Salt Lake Bees, AAA, and University of Utah, as you mentioned. What initially drew you, outside of the research and taking care of players and learning from your experience in the athletic training room or in PT, what drew you to essentially, zero in on a focus shoulder, elbow, and injuries and kind of overhead throwing athletes?
Yeah, I mean, I think that the shoulder and elbow are the most interesting parts of the human body, and anyone who's listening who's ever had a shoulder injury knows that it is incredibly disabling to have your shoulder injured. Like there's research, for instance, that having shoulder arthritis has a bigger impact on your quality of life than having heart failure.
Wow.
And I think the people who come to see me in clinic say that. They say, look, my shoulder is injured and my life is ruined. Like I can't do anything. Yeah. And we see that with our athletes as well. They say, my shoulder's injured and I really can't participate in my activities. In baseball, when you throw a baseball, that is the height of shoulder performance. When you throw a baseball, there's 1,000 newtons of force that goes through your shoulder. When you throw a baseball, the humerus rotates at over 65 miles per hour, the same rotational speed as your tires rotate at 65 miles an hour.
Sure.
So it's an incredible amount of force. It's an incredibly it requires incredible flexibility and strength. So to me, that's the challenge. I mean, that's why I like taking care of baseball players is they demand the most from their
Mhm.
shoulder. So I figure if I can take care of them, then we can take care of anybody.
Sure.
And I think that's what keeps us engaged in the job is making it challenging.
Hmm. And a big piece of, your work is research and education. And one thing, I was able to hear you speak at the baseball team medicine conference in January, that PBAT's hosted with Banner Sports Performance. You gave a presentation on the throwing shoulder. You talked about, the makeup of the shoulder, most common indications for surgical treatment, returning to play, returning to throwing. At your presentation, I know we just discussed offline it very in detail, a ton of images that we can't show here, unfortunately. What was your goal there? You were speaking to athletic trainers, to team physicians, PTs, very experienced individuals. What was the goal with the presentation, and what did you want people to take from it?
Yeah. So first off, it was a huge honor to speak in front of your group, and I thought the Banner did a great job of hosting, and I thought the
Absolutely.
PBATS program put together was great. So hats off to PBATS for a great meeting, and for those listening who haven't been to that meeting, I highly recommend that you attend virtually or in person is even preferable. My number one goal with that talk was to give trainers a better understanding for what is the quote unquote normal baseline for a pitcher.
Okay.
One of the things that we've been extremely fortunate to work with the commissioner's office on is they've provided, we started with the HITS database, and that obviously is important to understand what are the injuries that occur. But what we've
Mhm.
been doing more recently with them is they've provided us with a lot of imaging that's done on normal players. So these are players going through the combine. Some of these are in prospective studies that have been done where they MRI'd all the players of a certain type. And so through that, I've looked at hundreds and hundreds of MRIs, and we've collated a lot of data that's been looked at from MRIs me and Brandon Erickson looked at, or MRIs that Hollis Potter's looked at. And through that data, we can provide a picture, an understanding for this is your baseline. And I think that's really critical for players to understand of, when you get an MRI and it says there's a slap tear, it says there is, reaction in the posterior superior humeral head. Is that abnormal? Does that mean my shoulder's ruined? All the time, players will come to me with an MRI and they'll say, I got this MRI and it sounds like my shoulder's falling apart. And I think if I can provide some feedback to trainers to give them a better understanding of this is the normal pathology that occurs in the shoulder as an adaptation to throwing. This is the normal thrower's shoulder, so to speak. That
Mhm.
I think that can provide you with a lot better understanding for how to approach the thrower, and I think a lot better understanding for when I see a thrower, what are the likely things that they're compensating for? And my hope, therefore, was to give you a better idea of how to care for those throwers. In addition, I'd wanted to give some sense for what are the if that's the normal, what is the abnormal that should
Yeah.
lead you more towards a surgery? Because again, I think that trainers and therapists do just a phenomenal job getting guys back to play in most situations, but there's some situations where it's very hard to be successful or you're less likely to be successful with that route. I want to give people some idea of like what are those situations where you would say, hey, maybe you should go see the surgeon before we do 6 months of therapy.
Mhm. And when you approach the working with the athletic trainers, whether it's at the University of Utah or AAA Salt Lake Bees, when there are shoulder, elbow injuries, what's your approach in terms of your relationship with the athletic trainer? I know they are with the team every day. You may not be. They are probably a great outlet for you to learn about what's going on with the player, what they're feeling. But at what point do you step in or get called in to kind of analyze what's going on? And maybe, like you said, when is their surgery necessary? When can they kind of work to get them back to play without it?
Yeah, great question. I mean, so first off, huge shout out to John Fira. If you're listening, you did a great job as trainer for the Bees for so many years, and we're
Absolutely.
going to miss you because you've moved on. But I know Koki's going to do a great job in your stead. So I have really enjoyed working with the trainers for the Bees. I think they do a great job. All the trainers I've worked with have been really experienced, and hats
Mhm.
off to the medical staff of the Angels organization there overall. My relationship with the trainer is I think the trainer is boots on the ground who sees those players every day. So
Sure.
they by their very nature have to have a more in-depth understanding for where that
Mhm.
player's at. And that's so important, especially at the AAA level, because as you know, so many of the players, they're up and down, or there's so much roster turnover. It can be hard to get to know the players as the doc. So it's a little bit different than taking care of a major league team. And so for those of you who are listening who take care of the players in the minor leagues, and I'm sure there are many out there listening, that becomes really challenging because it's harder to get to know the player. So I really rely on the trainer to help me get a better understanding for this is where this guy's at within the system largely and, personally on the roster right now. Because I think that really does affect the player's approach to what's going on. And so that's been really helpful. And, we do whatever we can, obviously, in that relationship to figure out, okay, who is this? What is the timeline for return here? What does that mean for where this player's future lies in terms of, is this a quick thing? We're going to get this done. The player's headed back to Los Angeles. Is this a longer thing? This player's getting on a plane to go to Phoenix. I mean, those are decisions where really we have a lot of conversation with the trainer and the medical staff generally.
Sure. And obviously, today's game has changed so much from even 5 years ago, 10 years ago, back in the day, 90 to 92 might have been high velocity, which is now obviously it's not. The modern throwing athlete, as some might call it, in your opinion, are pitchers today, are they more at risk because of the speed? You mentioned in your presentation, just the speed and velocity of the shoulder and the movements. Or are kind of, more injuries coming up because people like you and your colleagues are better at identifying what's going on?
I think the answer to that question is yes. So I think one piece to it is the first piece where our pitchers are bigger, stronger, faster than they've ever been. And it's just physics that if you are bigger and stronger and you have more heat on your fastball, that there is more force that has to go through your elbow to get that force onto the ball.
Sure.
And so more force through the elbow means more force through the ligament. More force through the ligament means higher likelihood that it will tear. And I think it's hard to argue with that. I mean, that's just physics, and all of our research backs it up. And we've done a couple of studies that have really looked into that. So that's piece number one. Piece number two, which I think is important, is what you mentioned. And I will say that I think to some degree, especially when it comes to the ulnar collateral ligament and Tommy John, and we certainly do a lot of that kind of surgery here in Salt Lake, that we are the victims of our own success.
Sure.
That the players know that those surgeries have a high likelihood of return to play, so they are much more likely, I think, to jump in on that. So we see those numbers increase, and it's hard to know if some of those players maybe 30 years ago would have been treated non-operatively successfully. But
right.
I will say in general, our success with non-operative treatment of ulnar collateral ligament tears is not great. And our success with operative treatment is quite good. We're in the process of publishing our own results right now showing in excess of 95% return to play with those kind of injuries.
Wow.
In their surgical treatment. So again, I think that players see that and they're like, well, that's what I want, Unfortunately, we really don't see that on the shoulder side. And I don't think we've seen a huge uptick in shoulder surgeries. We do see some fluctuation in shoulder injuries, and definitely those are related to workload. And we've published some work on that showing that there is a pretty direct relationship between pitching beyond 3 innings and an increased likelihood for kind of those internal impingement kind of shoulder injuries.
Interesting. And obviously the research that you've done and you mentioned kind of kickstarted your career is very important and important to you and important to many of our athletic trainers across the league. What is most exciting to you, in the coming years, your research? Are there certain problems you're looking to solve? Are there certain things you're looking to uncover that have not been? What kind of gets you most excited about research and data as we move into 2026 and beyond?
Yeah, I think there's a couple of things that play into that. One of the things that I'm excited about there is the commissioner's office is doing a much better job of helping us to follow players longitudinally. So, historically, a lot of the research with hits was, let's gather a group of players that had one specific injury or one specific surgery that was done and see what happened to them going forward. And they've done a really good job of helping us to match them to controls to see how much that differ from players that didn't have that injury. But increasingly, there's enough data now to say, let's see what happened from the time that player was drafted until the time that player exited the league. And if we can get that kind of longitudinal data, you can draw much stronger conclusions about what are the risk, how do the risk factors play out over a player's career. And then we can really get into the preventative side of things. Because I think ultimately what I would love to see is for injury rates to go down.
Right.
I think that's one piece. The other piece to it is, a lot of our analyses to date have been more on the side of let's do logistic regressions so that we can develop explanatory models to understand what are the factors that contribute to injury. And those models are very helpful for understanding, like building a conceptual framework for what are the contributors to injury, but they're not always the best models for developing predictive analytics. And certainly, I think we've seen with the AI revolution that there are a lot of other ways you can analyze that data, develop better predictive models. And I think there's a lot of teams that are doing that individually. And I think there is talk within the league about trying to do the same thing to provide players with a better understanding for how do we reduce your risk. The challenge with that, of course, is that what we don't want to do is give players some sort of red mark and say, well, because you are this person at age 18, you're too high risk. Because I don't want to do that. I don't want to take players' careers away because anything you do is a percentage. So that's one real challenge we've had with that kind of effort, is finding that balance between how do we identify high-risk players so that we can mitigate their risk, but not how do we find high-risk players so that they can be devalued? Because I don't really want that for players,
Exactly. And that was kind of my next question. When the research begins, and we've talked with Corey Trumbull of the Marlins about this and Brad Pearson of the Red Sox, putting studies together, obviously you need athletes, you need people who you're going to collect data from. When you mentioned the high risk athlete, do you guys find that maybe there's a period of time where you're struggling to find people willing to participate because of that exact point where you're labeled high risk, there's a red flag? Is that a severe difficulty in the research aspect of baseball sports medicine?
I wouldn't say that it's a severe difficulty, but I will say that it's a factor that we are very conscious and careful about.
Okay.
So, for instance, like we did some prospective ultrasound studies using the Angels organization, and we managed to recruit all their pitchers to do ultrasounds. And one of the things I did when we did that study is I told the team, you can't have the data, you can't see it. No one within your organization can see it. And they were willing to do that because I think they are interested to figure out ways to reduce injury. And the players then were willing to do it. But if we do those kind of things and identify high-risk players and then that data is shared back with the team, then the player can really feel like this research was not in my best interest. And I think one of the things we have to be really careful about when we are doing any kind of research is how do we make the research the lowest risk possible for the participants? And that's true for any kind of research. And there's, as you know, all sorts of regulations that make sure that we follow that. But I'm really thoughtful about that when we do our research is if we're going to recruit a player, I don't want to do anything that's going to hurt them.
Yeah.
If anything, I want whatever we're going to do to help them, because that's, again, the reason we do that research to begin with. So we're really thoughtful about that in the way that we design our studies. And I think that means that there are certain questions that are more difficult to answer. And I think the players are rightfully cautious about participating. And I would tell any players listening that the researchers, at least if you do research with our group, we are very thoughtful about protecting you to make sure that that there's no way that your data gets leaked in a way that harms you.
Yeah, and interesting hearing you speak about kind of how you measure things and injury prevention. I had Dr. Glenn Fleissig, obviously legendary in biomechanics, on the show a couple months ago, and we had a conversation about the rise of motion capture and are we preventing injuries? Are we measuring them differently? Are we just measuring them better? Do you have an opinion on kind of how you compare data from the past with modern era data when kind of the measurements you have so much more available to you?
Yeah, I think that's a great point. And look, hats off to Glenn. He's done a great job. One thing I will say that's challenging to compare with Glenn's data is the vast majority of it was collected inside the lab.
Sure.
And you cannot get pitchers to throw with the same intent in the lab as you can from the mound.
Gotcha.
Facing live batting. So it's hard to know. Does that mean that it's different? Maybe not. But I think even Glenn would acknowledge that. But I think that the motion is one piece of the puzzle. And the motion, the challenge with the motion is it alterable? Has that, so many of our players, think about your average 25-year-old AAA player. Like that player has thrown millions of pitches.
Right.
So to say to that player, we're gonna mess with your motion, that player has usually found some local maxima that fits with their anatomy. To say that person, no, you're doing it all wrong is, I think, relatively disrespectful of the effort that person's put in to get where they are.
Sure. And when when you guys are gathering your data and you're looking, research you're doing with the commissioner's office, going forward, do you think there are any big gaps existing around throwing injuries and baseball research on pitchers and throwers? Or do you think at this point, the direction you're going in leading some of these studies and just research in general to keep athletes healthy, you're kind of in a place where you know where you're going? A lot of the majority of the big issues have been uncovered, or do you anticipate that you uncover some things that you're not even thinking about at this point?
Um, I I think there are a lot of gaps and there's a lot yet to be
Okay.
done. I I I think there's a lot of directions in which that can go. One of the pieces that I am most interested in is having a better understanding for what is the best way to manage youth and adolescent throwers,
Sure.
both so that they avoid injury, but also so that they get to later levels of play. And we've been looking at this recently with the commissioner's office and some research that hasn't been published to try and understand when you look at someone who's 25 years old who has a certain set of injuries, what did that person look like when they were 15?
Yeah.
And it may surprise you actually what that person looked like. The reason that matters is the 15-year-old who thinks they're going to become that 25-year-old, that expectation and reality may be misaligned. So
Yeah.
I think that's where a lot of where our work needs to go. And it's just that's another level of difficulty beyond
Yeah.
what we've done
Yeah.
thus far.
Yeah, that's a great topic, and what I wanted to be sure to touch on with you and your expertise is youth sports specialization, specifically baseball, specifically the advent of the pitching labs and the warehouses. And when we grew up and we were playing baseball, I grew up in the Midwest. I didn't throw a ball for 5 months because it was cold out. There was nowhere to go. There was nowhere to throw. Now there's so many performance centers, and you can throw and year round wherever you are. Do you have guidance for, if you were a part of Pitch Smart or giving guidance to youth parents or coaches? What should they do? They probably are looking for answers, how to keep their kid healthy, but also they don't want to prevent them from growing, from developing, from getting where they want to go.
Yeah, I think it's a fine balance. I mean, I think so. As you mentioned, the same is true here in Utah. There's snow on the ground. There's no outdoor baseball, but there's plenty of indoor baseball that
Right.
occurs in January here now. And so, and there's the other thing that happens here that I'm sure happens where you grew up is there's a lot of players that get in their cars and they drive south, and they continue to play in February even though it's
Mhm.
minus 20 here. So the thing that I think is an important piece is number one, I do recommend following the PitchSmart guidelines. They're very beautifully laid out on MLB's website. You can Google search them. I think they do recommend a period of time off once a year, and I think that's a good idea. But I don't think it's a good idea to do nothing during that period of time.
Sure.
So I usually will recommend cross training. I don't think it's even a bad idea to continue to do drills. So usually what I'll tell our players is I would love for you to take 6 weeks off around December, January, but I don't want to do nothing. I want to do a bunch of drills during that period of time. And the main reason why is to continue to keep some stress going through the ulnar collateral ligament. One of the things that we found in our study looking ultrasonographically at the ligament with the Angels is that during the course of the season, the ligament really adapts. It gets thicker, it gets longer. During the off season, it de-adapts. It gets thinner, it gets shorter. One of the things that's really unique about my experience here in Utah is I have a population of Mormon kids that are really intent on baseball, and then they go on a 2-year mission when they do no throwing. And then they come back, and I've had time after time, they come back and they immediately tear their UCL because they're
Wow.
bigger, they're stronger, and they've done no throwing for 2 years. And so their ligament is thin and it is short. So I don't think it makes sense to have no load going through the ligament. I think what we know about all the tissues in the body is they respond to load. That's true of your muscle. That's true to your bone. I mean, this is why people weight lift, right? You get stronger. This is the reason
Right.
why you see women walking, carrying weights because they're trying to increase their bone density. The same is true of your ligaments and your tendons. So I don't think that no load, like I think that load is good. It just has to be within a certain range. And I don't think you want to have excessive load all year long. So I usually will tell players, let's take 6 weeks and do drills. I don't mind if we play catch, but I don't want to do showcases. I don't want to do tournaments during that time period.
Sure.
Does that make sense?
Hmm. Absolutely, yeah. And I know recently there's been the kind of the dead period implemented for scouting, which has been kind of a controversial topic where, no showcase and things are going to occur at the, scouting level at certain levels for college and high school players. When it comes to sports specialization, in your opinion, I know you mentioned cross training for young athletes. How important is it for the young athlete to learn how their body works in different sports to build up different muscles and learn how their body works together throughout a year versus specializing in a single sport?
Yeah, I mean, the research on that, just to be frank, is conflicting. Like
Okay.
we did a study looking at that did not show much relationship between early single sport specialization and injury risk.
Hmm.
There's other studies that have shown that connection. What I usually approach it is with parents, and I think this is the right way to think about it, is that there are kids that are going to go play professional baseball. There are kids that are going to get college scholarships where it's going to really alter their life.
Hmm.
But for the vast majority of kids, the reason to do baseball is not because you're going to be a pro. The reason to do baseball is because you learn about hard work and
Yeah.
resilience and teamwork. And you learn about, like what it's like to play a game and lose and say, I'm gonna come back, we're gonna practice harder, we're gonna win the next one. And like those are the lessons that are really important and the reasons why
Hmm.
sports is so important for kids. In addition to, like learning how important physical exercise is and like you can get those lessons from other sports. You don't need to just play baseball to learn those lessons.
Hmm.
Now, if the parent is like, my kid needs to learn commitment, then I think you can make an argument to say year-long baseball is going to teach this kid commitment and that if you work really, really hard at something, you can get better at it with a continued focus. And I think that's a great lesson for people. I'm sure, Sam, you did not become where you are by not devoting yourself thoroughly to your profession.
Right.
But again, I think many of those lessons can be learned in multiple sports, playing with multiple teams where you may learn about team dynamics being different in different situations with different groups of people. That can be valuable. So I usually tell players this is a little bit of a mix and match. And if you're playing multiple sports and enjoying it, I would continue it instead of trying to single sport specialized, unless that's going to be a difference between a college scholarship or not. You know what I mean? And I'm not sure that's
Sure.
true at 10 years old.
That's right, and no, it's very refreshing to hear you say that. All you hear is kind of demonizing single sport specialization. When ultimately it's cool to hear kind of a take uh, research base that's different. And like you said, sports are so much more than just going to the professional level for so many people out there. But when it does come to kind of working with those younger athletes, you work with college students at the University of Utah. Have you found that over the course of your career in doing this, players coming into college, freshmen, younger guys, are they more physically prepared, arm health wise, to play at this level, or are they kind of just is it not changed much over the course of you seeing kind of that the freshmen coming to school at a high level?
Um, well, I mean, it's challenging to make that comparison because one of the big changes that's occurred during my career at the collegiate level is the transfer portal.
Right.
And when I started at the University of Utah, there was our roster, and I got to know all the guys. And every year we would have some new freshmen and some kids that graduated, but the core was the same.
Hmm.
And I loved that because they were my kids, you know what I mean? And I would
Yeah.
see them in the training room and we would see them at physicals. And so like if there was a kid who was injured, there was a kid I already knew usually.
Right.
And hopefully had an established relationship with. And this year, most of our roster was new.
Wow.
And I think that's because the University of Utah is competing against teams doing the same thing. A lot of the kids are coming from junior colleges where they've got established programs. And there are still kids coming from high school. I'm not saying that's not happening, but there's so much roster movement that
Right.
it's really harder to judge. It's harder to build a relationship. It makes me not I like I used to that part I don't love because I really liked that aspect of the team.
Yeah.
Doesn't mean they're not kids that are not there continuously, but that's really changed. And the kids coming from junior colleges generally have have put a lot of effort into their own arm care over time.
Sure. Yeah, that's a great point. And obviously, things have changed so much with NIL and the transfer portal. So you're not going to see a team full of freshmen running out there quite often now. Well, Dr. Chalmers, I kind of want to shift gears a bit. You have so much experience in sports medicine, in baseball specifically. For anyone listening out there who wants to break into sports medicine, they're considering that as a career, whether they're at undergrad or something like that. Are there skills and experiences looking back on your career and reflecting on that you either wish you had or that are extremely important to your development?
Yeah, I mean, first off, I feel extremely fortunate to have the job that I have, and I feel fortunate to have been given all the opportunities that I've been given, and hopefully you can hear in my conversation that I've had phenomenal mentors. I think
Absolutely.
that's a really important piece. If you can get one piece of advice, it's that if you can find someone who's willing to mentor you, who's in that field, that's like one of the most important pieces you can have. And I'm sure, Sam, you'd say the same, that you've had important mentors
Absolutely.
through your career that
Yeah.
have been so important to your development. I think that's one important piece. I think the other thing to recognize is that it's a real team sport. I mean, every day I work with, athletic trainers and coaches and parents and physical therapists, and there's so much communication and so much of us all fighting in the same direction to get players better
Mhm.
that I think it is more important that you are an effective communicator and team member than it
Yeah.
is that you are like an expert at statistics or predictive analytics.
Yeah, that's a great answer, and it kind of leads me to my next question. In a previous episode, I had Dr. Camp on with the Minnesota Twins, and he spoke about. I asked him about building trust with athletes as kind of someone in your position, a team physician or orthopedist, and he said it's so important for you guys to be around the players, not just to deliver bad news or to check in when there's an injury, but to be around when things are going well, build that trust, build that camaraderie. Do you feel the same way in terms of how you communicate and kind of your time spent around athletes?
Yeah, there's actually a lot of research on this in relationships in general. And the research suggests that for you to have a good relationship with someone, you must have a 3 or 4 to 1 ratio of positive to negative interactions. So I think everyone who hears this will find that to be true in their own interactions
Yeah,
with their friends, with their spouse, with their coworkers. And it's true. I mean, if you're around someone and you only ever hear criticism or bad news from them, you're like,
right.
I don't like this person. So
Hmm.
we need to have exactly that. You need to be in the dugout when the team wins. You need to be around for the player who's doing great in rehab when you're like, wow, you're killing it.
Yeah,
So that if something does go wrong and they have an injury, you can be like, I'm sorry this is happening to you right now. We've seen you through good times and we're going to see you through this too.
sure. No, that's a great answer, and gets me to my next point in terms of, you're super busy. We've mentioned everything you're doing in Utah with different teams. How do you day to day during the baseball season? How do you manage your time? How do you kind of take care of so many people and players throughout one single season?
Yeah, I mean for me, the critical thing with the bees has been that I develop a schedule that I go there as regularly as possible and interact with the players in the
Okay.
training room and the training staff. And sometimes I go there and there's nothing to do. There's no medical care that's provided. But I think that's part of what we mentioned earlier. For the university kids, we've tried very hard. It's part of the challenge this time of year with university kids is it's too cold to play baseball here. So they're in St. George, they're in Phoenix, and
Yeah.
I obviously am not currently there. So it can take a little bit longer in the season to develop those relationships, but certainly we work towards that. And again, I feel very fortunate to have the position to take care of those players. So we try very hard to honor that relationship, and because I think it's a privilege.
Absolutely. And kind of wrapping up today, Dr. Chalmers, obviously appreciate all your time. I know you're extremely busy. With the season kicking off at the collegiate level and minor league baseball very soon here, anything you're most excited about? Another year for you in baseball, another year taking care of players, their arms, getting them back to health. You've done this for so long. What kind of excites you when opening day for professional baseball comes around?
Oh, I think opening day is exciting for everyone every year.
Right.
I don't doesn't I mean, you act as though there's something that's going to be brand new, but one of the things that I think people love about baseball is the tradition. You know what I
Absolutely.
mean? It's funny because every time I talk to the commissioner's office and they suggest a rule change, I'm like, good luck. Like nobody ever wants anything to change in baseball, and
Yeah.
that's great. I
Yeah.
mean, that's why people love it. Is it's comforting and it feels like this continuous thread that runs through American history. And I love being part of that tradition, that every year opening day it's like another springtime,
Yeah, absolutely. We all waiting for those warm days, especially you in Utah, I'm sure. But summer's coming soon enough, along with opening day. Well, Dr. Chalmers, really appreciate your time and your insight as always. This was incredibly valuable for our listeners and our audience. And again, thanks for all you do for the profession and for PBATS, and we wish you nothing but the best of luck this upcoming season.
Oh, thanks so much for having me. It was an honor.
Thank you for listening to this episode of the Inside Athletic Training Podcast. For more information about PBATS and the profession of athletic training, visit pbats.com. See you next time.